Hi, everyone. I'm Gary Berman, host of the Cyber and AI Heroes Adventure Show. Welcome to the Put Data First pre-conference webinar. The mission of today's event is to provide the business community with a sampling of the thought leaders that you'll have an opportunity to network with in small roundtables at the exclusive conference, uniting business executives from major U.S. corporations to discuss AI's organizational impact, address implementation challenges and successes, and assess its transformational effect on business outcomes. The conference will take place at the Planet Hollywood Hotel in Las Vegas from Monday, October 27th through Wednesday, October 29th. Check out putdatafirst.com to learn more, and I hope to see you there in person. Today, we have a very special opportunity to listen and learn from an esteemed panel of medical experts focusing on the nexus of healthcare and AI. Our physician panel will explore how AI is reshaping the role of physicians, advancing next generation patient care, and transforming clinical decision support. The discussion will also address barriers to broader adoption, strategies for effective data governance, and key ethical considerations. Please remember to use the Q&A button throughout the discussion, and we'll get to as many questions as we can. And if not, we'll get to you afterwards. Well, let's get started by introducing Chris LaCour, the founder and host of the Put Data First conference. Chris, welcome to the show.
Thank you for having me.
Yeah, so all of this is because of your vision, along with the co-founder of Reliath AI, Herb Roitblatt. So Chris, tell us how you got here. What is your origin story?
Oh, that's a long one, but I'll keep it brief for purposes of today's webinar. And I just want to appreciate everyone taking the time out of their busy day. I know it's Friday to join us, so again, many thanks. So Reliath came about from me reading a online blog post. Herb and I have had a long-standing relationship. We both came from the e-discovery industry many years ago. And in fact, at that time, I was working with one of Herb's co-founders of a prior company that Herb had started and owned, and I was selling that software solution to corporate legal departments and law firms alike. Fast forward over the years, Herb and I remained in touch. He helped with a number of activities in terms of consulting work for me and the businesses that I was managing and running. And then more recently, as I was spending time talking with chief data officers, chief AI officers, understanding the problems that were plaguing them, I started to understand that there was an opportunity for us to come to market with a solution that could solve those problems. And so, hence the birth of Reliath AI, right? So, I think it's pretty clear from what we've been seeing and noticing in the news regarding hallucinations, and that there needs to be trustworthy AI output, and essentially that's what we're bringing to market. So Herb developed the technology, and I'm just really excited to be joining Herb in this path moving forward to offer this solution to businesses, right? So essentially, that's a little bit about how we got reconnected. And truth be told, Herb was considering retiring, and so I pulled him back out to come join me on this endeavor. And so I'm happy again that he obliged, and we're here, and we're excited about what we're going to be doing, and more importantly, what we're going to be presenting over at the conference at Put Data First. So Reliath AI will be demonstrating the platform, right? And there's going to be a great group of business executives coming from all across the country to the Planet Hollywood in Las Vegas to learn a little bit more. So just the start of many successful years to come. That's my story. Sticking to it.
Indeed, you did a good job. Thank you. And Herb, yeah, if you can unmute, we'll want to hear a little bit about what you're doing. What I can tell our audience firsthand is I'm privileged to have had Herb as a mentor. He's a renowned data scientist, amongst many other things. And when we first started talking together, it was about his book, Algorithms Are Not Enough. And this was several years before November 22nd and the proliferation of the GPT systems and things like that. So, Herb, welcome to the show.
Hey, thanks, Gary. It's good to be here.
So, tell us a little bit about your journey. It's pretty extensive as well. So, the floor is yours.
Yeah, well, I don't know where to pick up. I was studying dolphins in Hawaii, uh, studying dolphin biosonar, and building models using neural networks back in the 80s of how the dolphins would recognize targets. Eventually that led to a company called Dolphin Search, where we also applied neural networks to understanding the meaning of words. It was one of the early language models, although we couldn't call it a large language model at the time. And I founded a few companies after that based on that and other similar technology. And then Chris got a hold of me and said, that post you wrote, we got to do it. And because it was Chris, I was willing to do it. And I'm passionate about the ideas in it. I think we can make a big difference in improving the reliability and truthfulness and validity of artificial intelligence.
Indeed. And today we're focusing on the nexus of healthcare and AI. But the Reliant platform actually is more broad-based on highly regulated industries and things like that. Maybe you can share with our audience a little bit about that.
Yeah, well, we're not interested in planning your kid's 6th birthday party. What we're interested in doing is serving business needs. And we're focused on business. Each business gets their own model. Each business gets to decide what the truth is. We're not contaminated by things like Warhammer 40,000 telling you how to commit blood sacrifices. We're focused on business, focused on truth, focused on reliability, and we think we solve a number of problems that businesses need to solve to be able to use AI reliably.
Indeed. With that is some context. We want to now hear from Will Conaway, and Will is one of the most important thought leaders in the nexus of AI in healthcare and technology. And Will has had a storied background in the healthcare ecosystem. And Will, welcome to the show.
Thanks, Gary. Appreciate it. Good afternoon. I'm Will Conaway, and I'll be the moderator for this amazing physician panel. We're very lucky today. I'd like to say thank you, everybody, on this podcast today. We all appreciate your taking time out of your busy schedule to join us. We have about 30 minutes of questions, and we have allotted some time at the end for a few follow-up questions. Today, we have 3 of the most recognized voices in the healthcare technology. It's my great honor to introduce these people. First, Margaret Lozavatsky. Dr. Lozavatsky is the Medical Chief Information Officer and Vice President of Digital Health at the American Medical Association. She has a broad range of experience with clinical technology, digital health, and AI. She's a nationally recognized leader in healthcare informatics and has a passion for using technology to improve patient care. And I know that I've spoken with her a few times at the events. It's just amazing, her wealth and depth of knowledge. She's a member of the advisory board for the Association of Medical Directors of Information Systems. In 2021, she was inducted as a fellow of the American Medical Informatics Association. In 2023, she received the HIMSS AIMDIS Changemaker and Healthcare Physician Executive Award. She's one of a unique member here. She's one of the inaugural members of the Physician Advisory Board at Epic. She currently sits on the Epic Signal Advisory Group, and she serves as a pediatric hospitalist at Novant Health Presbyterian Medical Center in Charlotte, North Carolina, where she continues to care for patients. She's board certified in pediatrics and clinical informatics. Welcome. Next, we have Dr. Eric Lee, the Medical Director of Clinical Informatics at Altamed. Dr. Lee is a physician executive with deep experience leading healthcare informatics, clinical transformation, and digital strategies across large and complex healthcare organizations. His work's always combined clinical healthcare and health IT, supporting large ambulatory systems, statewide public health organizations, and diverse provider teams. Much of his career has been spent in settings that aren't always as straightforward as we think of in healthcare, such as federal qualified health centers, correction health systems, and safety net organizations, all difficult to navigate. His current role includes EHR governance for one of the nation's largest federally qualified health centers, serving over 400,000 patients from primarily underserved and minority communities in Los Angeles and in Orange County. As the reason he is here today, he is a highly sought after speaker for engagements, committee work, and collaborations with peers across the healthcare industry. He's well known for being a leader who continues to bridge the gaps between people, technology, and strategy. Dr. Lee's efforts have ensured that technology serves both the people delivering care and those patients receiving it. Welcome, Eric. And finally, we have Dr. John Fraunfelter. Dr. Fraunfelter is the Chief of Clinical Strategy at RhythmX AI, a company that is revolutionizing primary care decisions by harnessing the power of AI. At RhythmX AI, Dr. Fraunfelter is leading the strategy of how the RhythmX platform is applied to clinical practice. He started his career as an academic physician with board certifications in both pediatrics and internal medicine. He brings more than 20 years of physician leadership experience to address the challenge in today's healthcare. And his IT leadership roles include C-suite positions at large provider organizations such as Henry Ford Health, Unity Point Health, and Trinity Health. Additionally, his work includes executive work and consulting with healthcare startups and large technology companies. Welcome, Dr. Fraunfelter. So we're going to start out with a couple tough questions. And Dr. Lozavatsky, I'm going to start with you and maybe the toughest question we have today, and I'm going to go around the table and I'm kind of curious how you guys would answer. How will AI influence the profession of being a physician? And how would you characterize AI as being disruptive?
Yeah, that's a wonderful question. And I get this question all the time, particularly in my role at the American Medical Association. And I think that there are many ways that AI will influence the profession, and there are ways that it won't. And so I see the tools as additive to the clinical judgments that our clinicians have. And as we continue to utilize these tools, they will ideally alleviate some of the administrative burdens. And so I do believe there will be disruption because we will have to rethink some of our workflows, and we will adjust as we have more and more assistance with technology in the way that we deliver care. But central to clinical medicine is the physician-patient relationship, and I don't believe that that aspect will change or should change because that is so critical to the way that we deliver care today.
That's excellent. Dr. Lee, what is your take on this?
Well, I think AI is disruptive, just like well, it's not taught in medical school, right? Currently, it's not ingrained as part of the traditional medical school curriculum, and neither was finance. So I think this whole movement of becoming more financial in the healthcare industry was disruptive to physicians and clinical practice to begin with. I think AI is disruptive for that same set of reasons where it's not traditionally taught. We have examples of where AI is being used versus AI, like with, I refer a patient or I prescribe a specialty medication that's high cost. It gets denied because, certain insurance companies are using AI potentially to render in the decision making, and then we have to, if we're smart, we're going to use AI to help with our response letter, right? So I think it's disruptive in that we have to figure out how we're going to stay afloat, keep our head above water. It does have the potential to bring some humanistic aspects of medicine and clinical care back. We use scribes currently, AI, like ambient AI scribes, and it does allow the folks that use it to be able to spend more face time looking at the patient back, bringing the humanistic side back. But I think it's also disruptive again to the executives in healthcare that don't practice and they're not clinicians because they believe that they will be able to replace or optimize and continue to get more out of every dollar they spend, when in reality, medicine is based on relationships. And if you shortcut those relationships, you're going to continue to lose out on this. So that's several reasons why I think it's disruptive.
Now, I have to ask, you mentioned the question on finance, that it wasn't taught. So does that mean the next time the CMO is in my office complaining about something, I can tell him that Dr. Lee told me that you were not taught finance, you have no reason to be talking to me about this?
Oh boy, but we should, right? So I think it's a matter of like, how are you going to upskill, right? And reskill. And I think those of us from a physician standpoint have been forced to do that many times in our career. and it's something we have to continue doing.
No, totally agree. I love it. Dr. Fraunfelter, what have you seen? How is AI influencing the role of physician?
Yeah, I'll give you 3 points here. First of all, from a macro lens, it's going to be bumpy. I think when cars were first introduced, we didn't have paved roads. The roads were built for horses and wagons. So you get cars going down a road like that, and obviously you jar a few teeth loose. That's what we're going to deal with in healthcare for the next few years. Is AI is powerful, but we're not ready to bring it in across the organization to create a whole new ecosystem overnight. It's going to take time, and in the interim, and we're in the interim now, it's going to be pieces and parts of AI here and there, and that's going to create its own disruption, change management around workflows, et cetera. So we will get there, but we're in a transition time right now, which is really fascinating. I'd like to believe history books will be written about this decade that we're in right now. So that's the first point. Second point is how I interact with my patients, I believe will forever be changed. Although we will protect, to Margaret's point, the physician-patient relationship, that's sacrosanct. But patients now have access to AI. That's going to change how I interact with them because they have access. This is called democratization of medical expertise. A physician can use ChatGPT, but so can a patient. And they're coming in and asking different questions than they've ever asked before and wanting answers. And physicians have to approach this humbly and not sit in a hierarchical relationship in that interaction. It's more partnering than it's ever been before as a result. And I think that that's powerful. The third point is that I believe ultimately AI, for better for worse, and you could argue both sides of this, is going to bring incredible transparency to all aspects of healthcare, high visibility to everything that's done. And like I said, you could be uncomfortable with that or comfortable with it, but it's coming. So those are 3 macro lenses that I have on that.
No, I appreciate that. I like the your background with the Henry Ford Health and how you slipped in the car example too. That works well. And
Exactly.
I'll just kind of throw this out at the three of you here if someone wants to take a stab at this. I mean, you mentioned, and both you and Dr. Lozavatsky kind of mentioned people getting the patient being part of understanding, AI now. Are you guys finding the Dunning-Kruger effect going? That being someone reads something one time and all of a sudden they're an expert on it. And I'm finding that I've never felt smarter, when I read stuff on AI all of a sudden. So are you seeing that too as physicians, that people are coming in, they're talking to you, they already know the solution?
Well, I will share. I am a pediatrician. I practice in a hospital setting. And of course, parents, as you might imagine, have a lot of questions and they are looking things up. And the way that I have approached this is I welcome it. The reality is that information is out there. And I appreciate when people are upfront about it. So when patients ask me for advice on how they should handle what's on the internet, my response is always, go ahead and read what you can find and then let's talk about it. And I think that that's the most productive way to do things. This is not that different than when the Cures Act happened and all of the results were being released. And particularly in the hospital setting, they were usually released before I got to the room. So parents to this day have lots of opportunity to Google all of those things and draw conclusions. And sometimes they're not the best conclusions. And that is an opportunity to have a discussion and to have them share what they found. And then we can talk about the pros and cons of what information is out there. We can talk about the treatment plan, and it becomes more of a partnership than the paternalistic model that we've been traditionally used to. So I think as AI tools evolve, we will get better and better at this partnership and discerning what makes sense and what doesn't.
Yeah, that's a lot of good insights there. Dr. Lee, I got to ask. I mean, your wife's part of the medical industry too, so I mean, you guys must have some interesting conversations about just that.
Is there,
Yeah.
Will, is that directed to
Oh,
Dr. Leo?
sorry.
Dr. Lee, yeah.
Oh, okay. Yeah, my wife is a practicing hospitalist as well, and doesn't use AI, doesn't use an ambient scribe in the inpatient setting. So just the simple questions of how do you do this at home when she's using electronic health record, and I'm supposed to be the at the elbow IT support, right? But to get back to your question, yeah, there's a lot of interesting conversations that end up happening, and Some of it is just on the framing of it, of how you are asking, right? Asking your questions and how it gets answered, right? So, and context is everything. So I think context is probably one of the most important elements that is often missing in why answers are off topic or off, just a little bit off. And the nuances, again, of why humans have to be in the loop to be able to provide the full story and to say, this is what you're missing, and have you considered this, and this is why we went down this decision pathway. We're working in 4D, their work, ambient or AI or whatever you're asking is really more of just a transactional kind of interaction. So it's more 2D, unfortunately.
Love it. That's great stuff. Dr. Fonfield, I got to ask, how do you see AI transforming patient diagnosis and treatment in the next 5 years?
Yeah, thank you. So to Eric's point, AI without context leaves more challenges and more problems. It leaves a lot to be desired. So when AI has context and when it's done the right way, it's going to be transformative. And I'm going to paint that picture for you for a second. It will accelerate our ability to make accurate diagnoses. It will help us develop individualized care plans where right now evidence-based care medicine is approximately 20% of the care we render, but there's so much out there that data, et cetera, that is available. If I can use that with AI to say, these are the next 5 things that can be done for that patient that go beyond the evidence-based guidelines. Okay, that's what's coming. Now, I'll say, and this isn't, apologize, it's not a commercial, but I joined RhythmXAI for exactly that reason. The way we've built the platform is got the sophistication, the clinical validation, addresses the bias, the transparency, et cetera, the ethics of it in order to generate trusted outputs. It's not 5 years away. We're doing that today, but it will take 5 years to diffuse it in the industry. It was 2022 when I sat on a panel at Vive, and this is just when generative AI had come out, and it was 2023, and we said it's going to be 2 years and everyone's going to be having digital scribe, and we were just about on track with that. The diffusion of this sophisticated AI is as radically transforming, but it's going to take a little bit longer to come into being.
That's interesting to hear. I'll ask, Dr. Lee, is looking 5 years right now, is that the right time frame that we should be looking at in a field like healthcare, where it often seems that things move slower than other industries? And I mean, given that AI is already making, I would say, tremendous strides within healthcare, is 5 years out the right number? I mean, it sounds like it's going to take a little longer than people think.
I would say yes and no, right? I think for the innovators, the innovative spirits out there, I think 5 years is probably right on point, and being able to introduce new products, new lines of thinking, and new use cases. I think on the flip side, however, when you're working with folks that are resistant to change or have a distrust in AI and what it could deliver, or executives that are loath to spend without a proven ROI, I think that's probably why 5 years is probably right about right, in terms of like the overall change management cycle. But I think it's too hard to say, right? We expect AI to be perfect. We know it's not. It's better in some things than humans, right? But we still have to be in the loop and provide that context and provide that oversight. So hard to say.
And Dr. Lozbaski, I'm going to ask you that same question. Obviously, you work with an organization that has a very broad viewpoint and perspective on this. Is 5 years what your group's talking about at this point?
I think this is a really good question, and similar to Dr. Lee, my response is it depends. I will say that we've had some really interesting findings in our physician survey around AI, and we have now done it for 2 years. So once at the end of 2023 and once at the end of 2024. So we will have another one in the upcoming months. And a few of the findings will help answer this question. One of which is we asked physicians, are you using AI tools? And that was the biggest increase in terms of utilization that I have ever seen in any technology adoption. We went from 38% to 66% of physicians are using AI tools in their environment. And remember, these are physicians in all care settings. So this is not just the large health systems. These are the 1-2 doc shops, the rural health physicians across the country. And we are seeing adoption at unprecedented rates, in my opinion. I would say COVID may be the only exception, but as you know, we backtracked very quickly after COVID, so I don't think that counts. And we also asked the question of what are some of the barriers to adoption? And I think that also helps to talk about the timeline of where we should be thinking about. And the top barrier was trust. And I think it's easy for us to say that physicians are resistant to change and they don't like to do things differently, but there are reasons why. And the biggest reason in this space is the fact that we all want to deliver safe care, and we don't yet trust the technologies with good reason. The outputs are not reliable often. There are hallucinations, inaccuracies. We know that the data that is being used to train these models is flawed. So physicians are savvy and recognize this, and they're very nervous about using these tools. Another really important finding was that people asked for a feedback loop. They said that they need to know that when things fail, that they have a place to go. And we as healthcare organizations haven't necessarily delivered on that promise. And so I think that looking at 5 years for the technology is too far. Technology is evolving way quicker than 5 years. But taking into consideration the realities of clinical medicine and what it takes to implement these tools, 5 years is a good time frame for us to really envision where these technologies can provide benefit and how we can ensure that we're integrating them safely and effectively into clinical medicine.
No, I like that. One of the things I've been talking with numerous CEOs here of late and of healthcare systems, and one of the things that I find it's hard to trust and implement what you don't understand, and their hearing is not accurate. They don't hear it from the physician's perspective, or understand it from that deep of a knowledge. And that is something I hear almost every day. I really don't understand what I'm supposed to be doing. And so that has to be gotten past. Dr. Fraunfelter, what are you seeing out there? I mean, you've seen things on both ends now. You're working with a large organization. What are you seeing as some of these barriers to the broader AI adoption?
Yeah, trust is one of the biggest ones, and you're going to see more coming out in literature, medical science literature, and I think this year about the reliability of AI. It's already starting to come out. But then secondly, what's the ROI? And if the first barrier is trust, then the second barrier is we actually need it to deliver on value. We don't want any more shiny toys. And the measurable benefits in the latest study that I read, I can't quote it a line in verse, but 90% of the AI deployed did not produce an ROI. That's not viable today in healthcare. So we have to demonstrate a very clear ROI in order to get past that barrier. And then secondly, AI vendors themselves in the AI in the healthcare industry, AI vendors have to get out of our own way. So many companies are going to be here briefly and then they're going to vanish. And I call it AI tourism. You might have heard that term before. I didn't make it up, but they are leveraging maybe just a thin user interface layer on top of a large language model. That's not going to deliver trust in healthcare, and that's going to cause problems. And so again, it's trust, it's ROI, and then perception and credibility in the community at large of AI in healthcare.
No, I like that. I think one of the things I'm also seeing from a vendor perspective, and feel free to argue, is that I'm seeing a lot of vendors not using the healthcare organization's data. They're using data that they've already established, and then it makes it tricky when you go back to talk with the health organization, because you're comparing two different things at points, and that can be very misleading to organizations. The other thing I think is expectations from vendors really need to be tailored down some. I often hear where people are saying 25-fold ROI. I'll tell you, I have never worked on any project in my life that had a 25-fold ROI. And I think that once those expectations get down to maybe 2 or 3-fold, then people are going to start to be a little more receptive. But Dr. Lee, I have to ask. I mean, you're working in an organization that has grown rapidly over these last couple of years. How can AI help reduce some of the healthcare disparities among various patient populations? I know that your group has done tremendous work. You and Ray out there have just been really on the national spotlight over these last couple of years, and won numerous awards. What are you guys doing? How are you seeing AI bring it in? What are you talking about as an organization?
I think one of the first questions we approach problems with is just addressing cultural sensitivity and being as culturally sensitive as you can with the patient population that we serve is probably our guiding light, right? And it's part of our mission. So, for example, with ambient AI scribing, I mean, this was first available in 2021. It wasn't available in Spanish.
Mm.
That's almost half the patients that we see have a preferred language that's Spanish. So I'm like, how can I justify millions of dollars being spent on a solution that doesn't serve half our patients? So most systems probably will either do an amendment on an existing contract because it's just easier than negotiating a new agreement. Our challenges were really more of like, can you support multiple languages? Can you support the threshold languages within the 2 counties in California and the threshold languages of the state of California? And so that's probably our first question that we were always looking at, and then looking at, doing what everyone else was doing, which was, is it accurate? Is it, how is the output? How good is it at hearing? And so when does it auto recognize languages, right? So these are the additional considerations we have to take. Some health systems cap at 10% Medicaid, right? And we don't. We have 70, 80%, Medicaid, managed Medicaid or Medi-Cal patient population. So that's where our focus is completely different. It's shifted, but we're just trying to be a little bit more culturally sensitive.
Makes sense. And Dr. Lozavatsky, obviously AMA focuses on some of these things. What are you seeing? And also, do you see any applications out there that if you've seen so far AI related that might be promising to help in healthcare disparities?
Yeah, we absolutely think about this, of course, because we want to make sure that these tools support the delivery of the most equitable and quality care to our patients, which is the North Star for all of us in clinical medicine. I don't necessarily, in my role, evaluate specific tools, but what I will say is that if you take a step back and think about how AI can support this space, in my mind, what is the greatest benefit of AI tools is the ability to evaluate large data sets in a way that the human brain cannot. And that married with clinical judgment can produce better outcomes because we have not always been able to evaluate all of the data that is available. And to me, that promise, of course, is at risk with the current data sets that we have because we know that they're flawed. And so ensuring that we're evaluating those data sets thoughtfully, understanding how they can potentially contribute and worsen health disparities, and ensuring that our tools are tested at the local level. To your point, they shouldn't be tested on data sets that are not real patients. They really need to be tested at the local level where care is delivered, so they're representative of the patient populations that we serve. Setting that infrastructure up in these early days where we are today is going to be critical for us to be able to continue to work towards improving health equity.
Very deep there. Excellent. Dr. Fraunfelter, I'm going to ask you that same question actually too. What applications are you seeing out there helping patient care? And I know that you have a deep background. I mean, you've created solutions at large organizations that have had tremendous effect on populations of health. I mean, obviously, you've looked at things from the physician standpoint, a nursing standpoint, the patient standpoint. I'd even say clinical ops and processes and revenue cycle, even into the business. Where are you seeing some applications out there that are getting your interest and making you say, hey, that's something we need to look at?
This is the space that I love, is that we can leverage AI to close a lot of the gaps and fragmentation in healthcare today. And let me tie on both Eric and Margaret said as well. Let me start with the patient experience side of this. You know, they say a rising tide floats all boats, but right now, in many places, we're in healthcare deserts around the country. We don't have any water in the lake. And there are patient virtual agent interactive agents, voice agents, et cetera, that can interact with patients that can be very powerful, get them improved in health literacy, help them figure out how to get access to even schedule an appointment and see a doctor, like some of the basics. There's so much opportunity there. And so patient-facing applications, they're coming into the space. Insurance companies, health systems are starting to use them. That's a wonderful opportunity. Of course, the space that I'm in right now is on the care delivery side with physicians, with nurses, with mid-levels, APPs, the ability to be more effective in the work that I do every day. It's no longer clinical decision support. Throw that term out. It's cognitive support, that I'm being the best version of myself continuously throughout the day. Requires, again, as we've discussed, AI that has patient context. But the third place, which I think is really intriguing, is care orchestration. AI with automation, agentic AI that ties processes together, and the patient, the clinicians, all the multidisciplinary care team, the orchestration layer, I believe, is what's coming, and that's also going to be very exciting.
I love that. Just kind of going back to Dr. Lozavatsky's question about barriers that you had. You know, something that kind of popped to mind is ethical considerations. And I hear this more. I know there's groups like TTIC who have been kind of trying to talk with boards and CEOs of companies, of healthcare organizations, that is, to really understand where the ethical considerations should be. I know there's kind of broad rules for this. You know, we want things to be fair and not discriminate and safeguard, protect data. What should we be concerned around with the ethical considerations from a physician standpoint? And Dr. Lozavatsky, I'll go to you first. I think that you probably have a solid background in this.
Sure, absolutely. We at the AMA think about this a lot. We've done a lot of case studies and have partnered with organizations to explore this question. But what we have come to is that there are ethical considerations that exist today. There's a code of ethics in medicine, and we need to evaluate these tools with the same perspective, which is to do no harm to our patients, to make sure that we continue to provide the best, most ethical care to our patients that is equitable, so we treat all patients the same way. And it really goes back to ensuring that as we look at each one of these tools, that they are thoroughly vetted. And when we integrate them into clinical medicine, we are evaluating their impact on outcomes and tailoring them to the environment of the patient.
Wow, that makes very good sense. Dr. Lee, are you doing do you guys have talks at Ultimate about ethical considerations in AI and how you bring things in? Is your top leadership there coming, talking with the clinical people about this?
So when Ray Lowe and I, he's my CIO and my DIA partner, when we recently met with the CEO and the chief of staff about talking about AI strategy. And again, part of this is really what are the opportunities, and then in terms of an AI governance committee that we have and looking at the ethics of it, a lot of this, I think, in terms of what we try to introduce and how we implement it, again, right, in multiple conversations through the governance committee, because I think of our organization's unique lens and our mission statement, I believe we're a little bit, I think ethics is a little bit less of an issue for us. It's more of an issue in making sure that we go through the necessary change management and the right planning and preparation to make sure that it's properly used. So, for example, I had a provider agreement that I had each and every provider had to review and sign, and it had multiple elements, right? One was you need to always ask the patient verbally for consent before you record them. I mean, I don't know if that is commonplace around the country, but I would think ethically you probably should, right? Especially since in California we're a dual consent state. Second thing is you're not going to have an umbrella statement saying, please excuse any autocorrects or errant typos, because I was using ambient AI technology. That's not excusable. You got to read and proofread your note, right? So lastly, you should be, before you're signing the note, saying is you carefully proofread this note before, and it was co-created with you in generative AI, right? And using your progress note before it's released to the patient for the patient to read. So, I think it's some of it is just simple ethics of like, how well was it constructed? What is it based on, right? What large language models are they utilizing and all of that? But ethically, I think we have an obligation to make sure we introduce the technology responsibly to our employees and our staff that are going to be using it as well, and trying to educate them and making sure they know these are the minimum guardrails you need to know and be cognizant of before you start using this.
I love that. I'm going to ask kind of an odd question here. It's been bugging me as I hear you talk, everybody. And how can AI assist healthcare professionals in their decision-making process? I'm also thinking, how can AI help with the situation where many articles and many surveys and such have shown that there's about a shortage of 86,000 physicians projected by 2036. We can also look at what is building that problem, and that is physicians that are 65 and older make up about 20% of the clinical physician workforce right now. And between the ages of 55 and 64 is about another 22%. I believe they call that the silver wave. So that's a large amount of physicians who are getting at that 55 and older. And just to add to that, the U.S. population is expected to grow about 8% by 2036. So we have a lot of moving items here. How will AI help with that situation, and also help with as physicians get more pressure when there's less and more need? Can that help with the decision-making process and maybe eliminate some decision fatigue that we often see that anybody who's overtaxed and overwhelmed can experience? Dr. Fonfelter, I'll go to you on that one, since you have the nice silver wave hair today.
Yeah, I resemble that comment. Thanks, Will. So the first point is, and there's a whole lot there to unpack. I'm just gonna make a couple points because you could spend a whole hour on this. But one is, what's gonna fill that gap? There is an unprecedented wave of APPs being trained and hired in the next 5 years. I've talked to organizations where they're increasing their APP workforce by 50% or by hundreds every year within individual organizations. So you multiply that across the country, and AI can help them become more effective, more understanding of clinical guidelines, train them in real time while they're working, like we've done for years, but in slow motion. We need to accelerate that whole process of upskilling the young new professionals coming into care. And that's not going to close the gap, but it will help. That's one thing. Second thing is, I really believe, again, this is about supporting cognitive work now. It's far more than decision support. And again, the problem is a lot of the AI tools out there are not reducing cognitive work. That needs to be tested and measured in the real world. We need to do A/B testing to say, does this actually make them more efficient? Does it make them more effective? Are we more compliant with the guidelines as a result? And look at hard, comparative effectiveness research type approach to, is this better or not? We can't afford to keep misfiring like we've done with evolving technologies. I'll stop there. I've got to save room for others. So
I've got to get a couple more opinions on this because it's an important issue. And Dr. Lozavatsky, what are you feeling about this? Will this be able to help our situation with the growing need for more physicians?
I think it's a really good question, and there's a lot of conversation about the shortage of physicians, and as was mentioned, the number of APPs that are coming out of training. I see this as an evolution of team-based care, and more specifically physician-led team-based care. I don't think that the training that physicians have can ever be in any way replaced by these tools. And I think it's really important for us to continue to have that training experience at the helm of these teams that we're developing. And I see the AI tools as augmentative to the clinician judgment that is going to continue to be critical. And so where I think the biggest value is in terms of AI with decision making in medicine is, and I mentioned this earlier, I think computers have this phenomenal power to evaluate large data sets and translate them into useful information. And I heard a really great statistic that talked about how much clinical data there is out there on our patients. 50 years ago, there were 7 pieces of data on each ICU patient. Now there's about 1,300. And if you think about the permutation of 1,300, that is more than the pieces of sand on Earth. And of course, none of us are able to trend this data to come up with useful insights in a way that AI tools can. And so I see it as almost an assistant that is there to help bring information to us in a way that's meaningful and allow the physicians to use their time for clinical decision making, understanding the context of the patient. It would be great if computers could understand those things, but that's not what computers are good at. That's why you need that human relationship. When I walk into a room and I see a sick child, I just have to take one look at them and I know that they're sick. That's not something AI can do. Those relationships that we build, AI can't replace. And so I do think that the biggest role is that ability to gather in data and translate it into information.
I don't know where you came up with that statistic, but that's going to bug me all week. That is unbelievable. 7 to 1,350 years. That'll let you know. I hope that's not going to. Yeah, I mean, you have to have something processed. That's an amazing statistic. Eric, Dr. Lee, I gotta go to you and give you a shot at this too. It's only fair that you get to say something on this or on these comments.
Yeah, thanks, Will. And this is such an interesting question because I love what John and Margaret have brought up, and just I'm going to take a slightly different take on this, and that I think the kids of today that are just used to technology, it's part of their childhood. When they start seeking healthcare on a regular basis, and when they're in 20 years, right, and they're in their 30s and 40s, are they going to feel comfortable going into a kiosk at CVS or name your drugstore and just kind of have a back and forth conversation, insert their arms into a blood pressure cuff and some other devices and just get blood draws or point of care finger testing done and suggested diagnosis to their issue right then and there, and that then gets beamed up to a physician working somewhere else, overseeing 2 or 3 of these kiosks, just like we would oversee a couple of APPs. So that may be feasible, right? That may be the generation and the time in which it does evolve over time. But I think it's really going to become dependent on the patients of the future and their comfort with technology and their comfort of, we've used AI long enough that we know that it can be wrong. It could be, so they may have that different sort of take through trial and error and through life, that that may be how it renders, right? Or it could be wrong, right? And it just ends up being that we just have to use it to fully assist us. But there's got to be creative ways to address this silver wave and this shortage that is not continuing to improve by any means of imagination.
No, totally agree. We're down to just a couple minutes there, so I do have a couple speed round questions for everybody. So you'll get a minute each, and I'm going to try to answer 2 of them. Then we'll get to our Q&A from the audience. And Dr. Lee, I will go to you first. What gives you a sense of optimism about AI's role in enhancing patient care?
It has the potential to take a lot off our plate in terms of the mundane, the administrative tasks. It's already restored the ability to just look at patients face to face when they're here visiting, like we used to do when we were in the paper and pen world. So to me, I think that's what gives me the optimism. If we continue to have the patient at the center, hold the patient first and foremost, I think the potential will continue to grow.
Love it. Dr. Lozavatsky, how about yourself? What do you see? I mean, what's making you so optimistic today?
I'm incredibly optimistic about the tool's ability to restore joy in medicine. We hear from our colleagues all the time about these administrative burdens that they're experiencing and the cognitive burden that we carry with us when we describe the number of data pieces on each patient that we're trying to keep in our brains all day and making sure that we don't forget anything. These tools have this phenomenal ability to take some of those burdens away and help us do what we love, which is develop relationships with our patients and help us feel like we're providing the best care possible.
Love it, love it. Dr. Fraunfelter?
Yeah, so they say necessity is the mother of invention. Well, if that's true, then I believe crisis is the father of innovation. And we're in a healthcare crisis. It's compelling innovation. And so with the technology being ripe, it's mature. We're in an acceleration phase right now in the next 5 years. That gives me cause for optimism.
Love that. And I will go in reverse order here. So we have to have one last question for everybody. And Dr. Fraunfeld, I will go to you first. If AI could provide you with one superpower, what would it be?
Well, it's very hard to answer seriously. So I would love to time travel, but given that it probably will never do that, I would at least love to be able to tell the future. And AI probably will do that at some point with some reliability, with a probabilistic insights. So that's it.
Love it. Dr. Lozavatsky, how about yourself?
So I will say that this was a question that I was asked previously in a podcast, and I thought it was a great idea. What I would love to be able to do is to read people's minds. I think that would be useful in just about any setting. We try to read people's faces and their body language, but wouldn't it be amazing if we knew what our patients were thinking? And in my administrative life, understanding what our colleagues are thinking, I think would be incredibly helpful.
I feel like you've
Love
been
that.
reading my mind this whole webinar, Margaret. So maybe you're there.
Love that. Dr. Lee.
I feel like it's how can we educate our workforce and our population at large. I think there's a lot of fears out there right now. College graduates just are having a really hard time getting entry-level jobs and finding work. And so how can we meaningfully educate and upskill and reskill a large part of our workforce that threatens to be replaced, right? Every day there's headlines, multiple headlines, lots of clickbait out there. So that, maybe that and as well as along with just transparency, what's under the hood with what are they looking at in terms of LLMs and how are they coming to these conclusions? So being able to source that, I think would also be wonderful.
Love it. Love it. Thank you so much. And Gary, I'll go back to you. We're talking superpowers. You obviously do a lot of superpower work, so we'll have it back to you for what does the audience need to know more about?
Well, first and foremost, this was just awesome. And I don't know if you could hear that sound, but that was my head exploding. Just so you know, so Dr. Lozovsky, that if you want to read my mind, that's it. And not to mention the whole superpower idea. My audience knows that amongst other things, we do superpower comic books to distill the complexity of AI technology into something people can get their heads around. Okay, now we'll be addressing some questions. Take it away, Alex LeBlanc.
Do you work on a way to communicate with the patients for AI adoption in a way for them to get a better acceptance of it?
So we are huge advocates for ensuring, of course, patient privacy and safe utilization of data. It's going to be really important for all organizations to consider how they build the infrastructure to be able to do that and to ensure that patients are aware of where their data is being used in a way that it's de-identified and it's safe and it's protected. Of course, there are laws around this, all of the HIPAA guidelines, but with AI, there are additional risks in that information getting out and being re-identified. And so again, going to be really important to make sure that organizations are thinking that through.
And we have something for you, Dr. Lee. You mentioned earlier about inclusion and access in healthcare. Can you elaborate on some of the specific steps that you recommend?
So, I mean, it needs to become part of your organization's culture first and foremost, right? DEI was a big movement about 5 years ago that has largely regarded as lip service with a lot of corporations, unfortunately. And so, how do you go about trying to be more intentional with that? And I think I think you have to start with certain aspects, right? I think at least within my organization, it was really more of like, how can you ensure that it automatically recognizes patient languages, right? If you start with a patient and you ask, what are the challenges that they face? What are their concerns going to be? Um, you know, they don't want their patient recordings of our visits released or hacked, right? So how do I ensure that we did our due diligence from a security perspective to make sure that it is protected? And that's part of my spiel with these patients as well, right? So I think it really has to be like, how are you going to train your workforce? How are you going to evaluate these tools properly? That's the little bit that I can do, right? And then, but there's other areas of the organization where it has to be really important as part of HR. It has to be really important as part of talent acquisition. So it can't just be lip service. It really has to be embedded within all areas of the organization.
Well, indeed. I hope that you all decide to do this again because I think the quality of the conversation, the passion in which you deliver it, is incredibly important as we all embark into this area of uncertainty, but tremendous promise. And so, on behalf of a grateful digital universe, Dr. Zolzowski, Dr. Lee, Dr. Fraunfelter, Will Conway, thank you all for who you are, for what you do, and most importantly, why you do it. And to our audience from the Cyber Hero and AI Adventure Show, stay tuned for more.